The St Helena government's health and social care portfolio has overall responsibility for the island's health and social care services. This is led by the Health and Social Care Portfolio Director and supported by a staff complement of around 250, made up of both local and specialist personnel. Where the island is unable to accommodate or provide medical care services of a serious nature, the Health Directorate is responsible for referral of such cases overseas. This is done through our links with the South African and United Kingdom medical services. Central to St Helena's health services is a 28-bed, 24-hour hospital in Jamestown. We provide all of the primary and secondary care for St Helena, from GP appointments and the emergency department through to local operative care and overseas medical referrals. We have a modern, up-to-date theatre staffed by a resident general surgeon and anaesthetist, taking care of the routine operations and emergency cases. A strong team of emergency medical providers offer 24-hour ambulance support across the island.
So when we're presented with a challenge that we can't immediately meet here, the priorities are either to rethink that challenge into something that we can provide, or if that doesn't work, we have to send patients off island, usually to South Africa and sometimes to the United Kingdom for either investigative or therapeutic interventions. The Medivac system allows us to evacuate patients who are critically ill in as timely a fashion as we can. Now, bearing in mind we are a small island in the South Atlantic, that will always take 1 to 2 days. But we have facilities here that will allow us to maintain life support for patients all the way down to small children for that period of time waiting for a Medivac. I don't leave the island. The Medivac team comes to us and we deliver the patient to the airport for them to be flown off island, usually to South Africa.
Morning,
Morning, William. Come sit, take a seat.
We have a cohort of GPs that run everything from outpatients to inpatient care, from maternity to oncology. There are over 600 GP appointments each month at clinics located in Jamestown, Halftree Hollow, Longwood and Levelwood. We also provide a full range of specialist clinics, everything from dietitians to sexual health and gynecology, and from maternity to mental health provision. Other specialists make visits to the island when required, such as an optometrist, cardiologist and ophthalmologist, to name a few. The hospital theatre and ICU are well equipped. We have 3 Draeger anaesthetic machines, 4 Vyaire Bella Vista critical care ventilators, 5 Aero high-flow oxygen kits, and all manner of ancillary pumps, monitors, devices, and paraphernalia. We have a resident anaesthetist and a surgeon who is a generalist in the broadest sense. Elective work can either be seen by visiting specialists or be sent to South Africa. Surgical emergencies are managed on a case-by-case basis, with either conservative management, transfer before or after surgery, or hopefully surgery and recovery on island. We have regularly visiting gastroenterology, orthopedics, ENT, urology, and ophthalmics. Critical care activity is mostly limited to straightforward cardiorespiratory support, which will either be short-lived and self-limiting, or will be in preparation for medical evacuation to South Africa. St Helena is fortunate to have a range of imaging modalities within the radiology department at Jamestown General Hospital. These include a new digital general X-ray setup, theatre C-arm, a recently replaced CT scanner and mammography unit, and ultrasound machines.
Yeah, we're lucky enough to have a Siemens Mammomat Select. This allows us to offer both a diagnostic along with a screening service for the local population. At the moment I hold 2 morning clinics for mammograms. That covers both the diagnostic and screening service. We currently have a CR machine, so we don't have the latest in processing technology, but most radiographers would probably be used to working with both. Once we finish with the mammogram, all images are sent to a reporting service in South Africa, where they review the images and provide the reports. These are returned to us and we do the follow-up with the patient, either myself or one of the GPs. So this is a CT scanner. It's very new. We've only had it for approximately a year. It allows us to scan most CT scans required on the island, including quantitative bone mineral density, as we do not have a DEXA machine. It also allows us to do cardiacs, along with most of the other work that we do here. Okay, so as with the mammography, all CT images are sent away for reporting, again in South Africa, so we get official radiology reports back. However, myself and many of the doctors here will initially review the images, especially in an emergency, to see if anything is required immediately. Working in these remote locations can be quite challenging. It's very important to be adaptable and flexible. We don't always have the necessary equipment, however we can normally manage with what we have. We work very closely with the other medical professionals on the island, which produces a good team environment and makes it, I find, a very interesting place to work.
Imaging is performed by 2 radiographers who live on the island. It is available 24 hours a day, every day, if needed in an emergency. There is a chemotherapy day unit at the hospital, which was set up in 2019 and is now able to offer on-island treatments for cancer patients. St Helena is one of the few British overseas territories with these facilities to treat cancer patients locally, allowing them to remain in a familiar environment with the support of their families and friends. In the event that treatments are not available locally, patients are then referred overseas. The chemotherapy day unit receives advisory support from oncology units in South Africa and the UK.
Oh, well, your treatment ready.
Thank you.
We have a full-time pharmacy at the hospital, which deals with all of the in-hospital medication and prescriptions for the general public. There is also a pharmacy bus that travels around the island, supporting those that live in the more remote areas. The annual flu vaccination program is delivered across the island by our community nursing team.
Good morning.
Alongside the care they offer in people's homes, from changing dressings and providing medical care to medication administration and palliative care.
So at the moment, our day could vary with patients. So we could have a day up to seeing about 20 or 25 patients sometimes, to a day where we probably see about 6 to 8 patients. So today I'm covering like 2 districts today. This is part of my work for today. We get gloves and we've got dressings, so there's gauze, dressing packs, saline water for cleansing the wound. We get aprons, we get hand sanitizer, clinical waste bag, dressings. Damodine, the iodine, the granuflax for all types of wounds. On this side of my bag, we also carry bloodletting stuff, and this side of the bag is all the bandages. So every community nurse will have a kit like this. Equipment for vital signs. There's a blood pressure machine, a blood glucose machine. That's another blood pressure machine. The otoscope, the pulse oximeter, the bit that you look in the ear and the eye. Thermometer. Because we can't run back to base, which is Half Tree Hollow Clinic, so we have to be well equipped with our equipment.
Dental services on St Helena are provided from the dental clinic situated within the hospital complex. All routine treatments are provided, with the exception of implants, orthodontics, and crown and bridge work. However, we do have the facilities and skill set to hopefully provide crown and bridge work, again in the not too distant future. The dental team is usually made up of 2 full-time dentists, 1 full-time dental therapist, 4 dental nurses, a dental receptionist, and 2 UK-qualified dental technicians who work in the on-site dental laboratory. We benefit from the services of an oral surgeon who visits on an annual basis and who is available for advice at other times. As part of our community dental service, we currently provide annual visits to all schools on St Helena for screening and dental health education purposes.
Amber 1, requesting a radio check, over.
Working as part of our emergency crew will offer a very different experience to your average paramedicine. Not only do our crews undertake life-saving emergency calls in our modern and fully stocked ambulances, they also operate the emergency department, running all tasks from triage to treatment with support and guidance from the clinical team.
So within our team, we have 4 emergency care assistants, we have 2 ambulance drivers, we have 2 emergency medical technicians, and myself as the only paramedic at the moment. Demand on our service varies daily depending on the emergency department attendances. We also accept referrals from the outpatients department, and on average we say we receive about 1 to 2 ambulance calls per day. So our call demand really varies. Most presentations are an elderly population because of the aging demographic here. There's a high demand for social care, as we attend a lot of care facilities on the island. And then we deal with the standard similar UK presentations, alcohol injuries at the weekend, things like that. But mostly it's because of the elderly population, we're dealing with that demographic. Not so much trauma, cardiac arrests. It's not all Gucci jobs as people think for a paramedic. It's the real stuff, the elderly people, that emotional connection with people, you know? So in our service, we're very well equipped we've got 3 ambulances. We've got 1 ambulance that's capable of off-road 4x4 capabilities so that we can reach those more rural parts of the island. We carry Life Pack defibs and Philip Heart Start Intrepid defibs, and we have most modern pieces of equipment that you would find in other ambulance services here. So the biggest challenge for anyone joining this department from overseas is probably the lower call volume, the elderly demographic that we have to deal with and attend to, and also being able to adapt to the island in terms of finding the properties that we go to. And that's where we really depend on a local workforce to help us out, and also overseas applications like What 3 Words, the Good Sound that we're introducing.
Our fully equipped laboratory provides a clinical service to the medical staff in order to diagnose, treat, and monitor various illnesses and diseases.
We are the support services are that we are a multidisciplinary laboratory. So we cover all disciplines like hematology, biochemistry, microbiology, blood transfusion. So the doctors call on us for full blood counts, all the liver function tests, cardiac function, kidney function, also for transfusions, if we need transfusions, especially we have a chemo unit here now, which a lot of patients require transfusions regularly, so that's the way we support them. Also for patients on anticoagulants like warfarin, we have to monitor those tests to know that the patient's on the correct dose. So the lab is well equipped here. So we have a hematology machine or two hematology machines. One as a backup because we are quite isolated. So if one breaks down, we have a backup. So it's all automated. It's a 5-part differential machine which does all the parameters for blood counts. We have two biochemistry machines, which are all dry chemistry machines, which does all our routine chemistry. We have an immunoassay analyzer, a Siemens analyzer, which does all our immunoassay work, like drugs, like infection screening, hormones, etc. And then we have some molecular machines, like a biofire and a gene expert, which does all our virology. And we have another machine, separate machine, which does all our HbA1cs for all our diabetics on the island. And then also there's a microbiology, which we have a blood culture machine to do all our blood cultures, although some of it is manual, but some is also automated. And then for our food and water lab, we have an IDEX system, which does all our water testing. So in the food and water lab, that is where the weekly testing of all the water samples. So the water samples are tested on a routine weekly basis from Connect. So that's all your potable drinking water. It also covers untreated water. It covers harbour waters and also the swimming pool. It also covers the airport waters, which we have to test every week. And then any food samples around the shops, any food premises for hygiene purposes, and also any fish or fish products which needs to be exported. So that is all done in that lab. And just to say that that lab is also 1705 ISO accredited.
Alongside all of this, the Directorate also provides all the environmental health services on the island.
Okay, so environmental health, we do a lot of things. We have a lot of core services we deliver, but basically we focus around the fact that we support the health and social services Directorate by providing those services and safeguarding the basic health of St Helena, and so that people can enjoy good health and well-being, really. So we're only a small team we have. So our team is split up into two predominantly units. So we have the core environmental health services, and we have what we call the pest control services. So a team of 10 people, and we have 6 people in the pest control services. So that's quite simple, that is, because we protected the environment from pests and any possible transmission of diseases. So that is their role. But within our role as environmental health officers, which we have a team of 4 at the moment, we deliver core functions such as like food safety, health and safety, border control services in terms of public health, infectious diseases and all that. We form part of a consultation team. Sometimes we are asked to give our opinions on certain, lands or land planning issues. So our role is kind of touch everybody, across almost like the government department. Our job is to protect the environment and the health and how those environmental stresses affects people's health. Because although it doesn't seem like quite direct to you, but indirectly certain things can harm you. So that's what we're there to do, to make sure everything is safe.
Our other major responsibility as the Health and Social Care Directorate on St Helena is the provision of social care for adults and children, meeting the needs of the most vulnerable in society. Children's social care works in partnership with health education, police, and other services to support and safeguard children using a multi-agency approach for all children until they reach the age of 18 years. The service is based in Half Tree Hollow and consists of 3 social care officers, 2 social workers, and 1 team manager, who are further managed and supported by the head of service. Our team offers assessments and support for children and families, often offering bespoke packages of support as deemed necessary. Adult Social Care headquarters is at Ladder Hill and plays a crucial role in supporting vulnerable adults over the age of 18 within the community. A team of 8 staff, further supported by the head of service, carry out work that includes supporting adults with a full range of mental health issues and learning disabilities, younger adults with physical disabilities, and adults transitioning from children's social care. In addition, we support older adults with acquired brain injuries, dementia, and general older age frailty. Supported accommodation provides a service user-centered home for adults over the age of 18 with learning disabilities. Currently, this service provision comes from 2 bungalows, which can accommodate the maximum of 5 adults at any one time. Social care includes 2 sheltered accommodation facilities. Here, we provide support with all activities of daily living for the vulnerable adults that are within our care, while also encouraging them to maintain as much independence as possible. Cape Villa has 13 individual flats that comprise of bedroom, wet room, and kitchen dining facilities. There are also communal rooms and outdoor spaces and an office. Cape Villa operates with 10 staff. Deason's Centre accommodates 9 service users with the support of 11 staff. The flats here have similar facilities to those at Cape Villa. The communal building can also accommodate 2 service users. Both of our sheltered accommodations cater for service users with a wide range of needs that are often changing. This requires flexibility and close working relationships with other multidisciplinary agencies to ensure the safety and well-being of everyone under our care. Emphasis is placed on keeping our service users integrated with community life wherever possible. Ongoing relationships and social interactions with family and friends are encouraged, which could include day trips and events outside, and also visits within the accommodation centres. Ebony View is a residential care home for adults with learning disabilities. Accommodation comprises 4 self-contained flats, accommodating a total of 8 service users. However, we only accommodate a maximum of 5 adults at any one time. Ebony View provides a person-centered residential service for adults 18 years plus with additional and complex needs. Known locally as the CCC, the Community Care Centre is a 45-bed complex in Lower Half Tree Hollow. It has a mix of residential and nursing care and is supported by community physio and community nurses who support with the most complex service user presentations. The CCC admits residents via referral through the Adult Social Care Team and Allied Placement Panel, thereby ensuring that the CCC is utilised as a service for those members of the community with the greatest need. The CCC provides expert, person-centred care to meet the needs of the individual resident. It also caters for the social needs of its residents via a range of activities designed to promote social engagement and enjoyment through music, art activities and outings. At full complement, the CCC employs 90 staff, undertaking a variety of roles, including 75 care staff. Domiciliary care is the term given to the range of services available to support an individual and help them to maintain independence and quality of life within their own home. Day care is currently delivered in the main hall of the CCC as a form of respite care to elderly adults and adults with additional needs and disabilities. Our domiciliary care team consists of 21 staff who support 48 service users within the community over a period of 7 days per week. As you can see, in health and social care alone, the work is seemingly endless, and there's loads more services we may have missed out, as we didn't want this video to run on. Our hardworking teams provide a 24-hour service to the residents and visitors to St Helena in what is a very challenging environment at times. We have an aging population and a decreasing work-age population. Non-communicable diseases like diabetes and hypertension are on the increase, which brings with it other health issues and an ever-growing demand on the system. The pressures being put on health are stretching the budgets year on year, but we are proud to say that we still manage to provide amazing life-saving care. So, that's it. A whistle-stop tour of the health and social care portfolio, the largest individual portfolio that is working hard to provide essential services to the people of St Helena.